So Jess, can you explain the workup process and what's involved?
Yeah, it's a very tiring process for someone that is sick. And that's something we appreciate. And it's a very tiring, taxing process on yourself and on your family members who may be taking you to these appointments. But essentially, we need to commit to this process to essentially demonstrate that you are eligible and a candidate for transplant. Unfortunately, there are times where people aren't candidates for transplant because of results from their results that they've had for the workup. So essentially, it differs between the heart and the lungs, not on a grand basis, but there are some tweaks along the process. But essentially, we need to show that other organs are okay and that they're going to be able to test the actual transplant procedure itself, because the transplant procedure is quite an intricate process. They can go to 4 to 6 hours, and we need to make sure that we're protecting your other organs so they're not damaged. There are a population of patients that do incur injury to other organs that may get better over time, but they may actually have to have other therapies after transplant. So the workup process may be done in hospital depending on how unwell someone is, but more times than not, we'll have it in the community with your local GP or your referring physician to help facilitate those locally, so it's a little bit easier. Some tests will need to be done at St. Vincent's though, purely because we like some of them here because it's our bread and butter.
Yeah, it was what, 14, 15 years ago when I did my workup. And I actually don't remember it that well because when you're a sort of transplant patient, you've already been to so many appointments.
They all move into one.
So yeah, you just go on a roll with it. And it wasn't something I found, I don't remember it being taxing. I guess at that stage it was just more about going through the motions, but I remember there's tissue typing, all sorts of blood tests,
lots of blood tests, lots and lots. And we've developed forms now so that there's tick boxes for those that like to have a tick box and checklists, and referrals all done for you. So it is more or less a streamlined process. It's just about getting those appointments in and done essentially.
Yeah. And then you sit down with a psychologist as well, from memory.
Yes, so we have a transplant workup session. So these are on two separate days, and they're both on Wednesdays, usually sequential to one another. And the first one, you'll meet our transplant CNC. You'll also meet a occupational therapist. So we have a really good overview of how the house is or home set up, your mocker, which is looking at your recall and things like that. And then you'll also meet a dietitian. So we really want to make sure that you're well prepared from a gastro point of view, and make sure that you're not malnourished, or if there's requirements to lose weight, we can help assist in that. Then you'll also meet a clinical psychologist or clinical liaison CNC. And that's all about mentally preparing yourself, seeing where you're at mentally as well. We need to make sure that you're fit psychologically, because people have had very difficult and have experienced disparities in their life. So we need to make sure that some of these triggers will be expected and then also managed post-operatively. The other people that you will meet, social work. So social work help with all those different family dynamics that people have. I mean, there is no one fit carer in a box. So different social systems and networks are very prevalent. So we work with you to try and determine your primary and secondary caregivers, and sort of working out a rotational roster, which may be the case, and that's absolutely fine. It's very difficult for people to take a whole 3 months off in that post period. So, and just education. It's really heavy on education to make sure that you're prepared as a pre-transplant patient and know what you're getting yourself into.
Yeah, and as with a social worker, they also can help you if you're like, I've interviewed a few people that have been sort of remote areas that have had to organise accommodation and all that sort of stuff as well.
Yes, exactly. So they help let you know the different types of accommodation options. Also on the night of transplant, we'll let them know so that they're aware and we can help tee up accommodation. And also just the other person you'll meet is a supportive care physician. So this is about symptom management. It's really important when you're on the wait list. It can be for 5 days or it could be for 2-3 years. So you're still going to be symptomatic in that time period. So we find it very important that we maintain symptom management accordingly so that you still have quality of life, because that's our main goal, is to improve quality of life. And if not, we need to maintain some sort of level of it while you're on the wait list.
Perfect. That's a good run through. Thanks, Jess.
That's okay.